first entered 3M, I went on to lead Action and to lead Straumann also. So it's been a long journey, a lot of experiences in different spheres of dentistry. And I thought I knew everything, because I had been to 3M and Action and Straumann. And here comes bleaching, which I knew nothing about. And it's amazing. I mean, every now and then you get a product, what we call as an ideal product for the patient as well as the dentist. And now, what is that ideal product? It should be easy to use. It should give you good results. And in today's generation, it should be pain-free. Everybody you talk to says, we don't want pain. I mean, I was really, terrified of going to a dentist, even during my entire, dental sojourn, because the pain is really, very, very bad. But today you're getting products that are easy to use, fast, give you good results, and pain-free. Blancone definitely fits. I mean, it's representative of the modern dental product after years of research done by the Italian guys. From where I come from Goa. At one point of time, 80% of bleach cases in the country was being done in Goa because of tourism. 80% of bleach cases in the country. Some of my friends are having two Zoom machines in one clinic, So it was crazy. But there they were challenged again about the extreme sensitivity, Again, the first time after 36 years in dentistry, I must tell you this experience. I was at Dr. Pawan's clinic in R.R. Nagar, and there was this young girl. It was 14th of February, it was Valentine's Day. So this young couple had walked in, Doc remembers, and she was really terrified because she had fluorosis. She was very pretty, but her centrals and laterals were all fluorosis. So that was the first Blancone case we were doing in your clinic, sir. We did one round. Now we were just keeping our fingers crossed because of the sensitivity, But she sailed through both the rounds, 8 minutes. Then came that magic moment that I've never experienced in all my dentistry. Doc gave her the mirror. She jumped out of the chair screaming. So her husband came thinking, what's happening in the clinic, She was screaming with joy. I mean, I've never seen this for 36 years. I've never seen, probably if somebody does a full mouth rehab and you get that kind of reaction. But first time, no 3M, no Action, no Straumann, have I ever seen this kind? Yes, we launched Lava, we launched CAD-CAM, zirconia crowns ages back, but I have never seen a reaction from a patient. Then I said, yes, we have $1 million product with us, because it repeated again in another clinic where Dr. Mithun was there. Here there was a guy, and we did the same thing, but he didn't have fluorosis. He had, I think, A3.5. It came on almost to B1 in 15 minutes. So the mirror was given to him. His reaction also was of joy, but not of extreme joy like that. But he says, tomorrow I'm going to bring my wife to the clinic, So this is amazing to see. This is amazing to experience. At one point of time, a beautiful smile and looking good was only for air hostesses and news anchors, Today, as I was exiting out of Straumann, the Swiss guys were telling me that even your salespeople need to have perfect teeth. They have to look good. Everybody wants to look good. India is the youngest population in the world today. The average age is 30 years old. It's the youngest population in the world. I'm a fossil. I'm probably too. But everybody wants to look good. And the demand, every dentist that we met during the registration process also says, yes, the demand is high, but we do not want to suggest bleaching because, of the extreme sensitivity. So here's an amazing product. I'm sure it's well worth the time that you'll have taken. It'll be as exciting as yesterday's RCB versus Chennai match, It's going to be really, really good. I can't think of a better speaker to be here present today, because Dr. Arun is an absolute rock star. I mean, I've seen him in various forums. He conducts his programs in Chennai, in Dubai, and in Malaysia. He's an endodontist by profession, but also has a fellowship in in digital dentistry, laser dentistry, and he's part of many international forums in the Gulf as well. So without much ado, I'd like to invite Dr. Arun Suraj on the stage to take us through the lecture. And one more thing, very unique. I took the freedom of inviting Dr. Pawan to share his experiences, because he's a Bangalore dentist and he's the first Blancone user of Karnataka in Bangalore. He's taken it to the next level. He came all the way to Hyderabad for our first course, from Bangalore to Hyderabad. He's done some amazing cases. So after Dr. Arun's lecture, Dr. Pawan will share his experiences of how it's worked in his practice and how it's really bumped up his ROI in his practice. Once again, let's enjoy. One of my first bosses in 3M told me one thing, what is the stupidest question that you would ask? So I didn't know what's he saying. So I said, I don't know. I mean, what? So he said, the stupidest question that you would ask is the one that you never asked. No? So let's be free. Let's just ask as many questions as we want, and I'm sure it's going to be a very exciting and interactive lecture. We have our partner, CERX Dental Lab, Dr. Prashant and his team. So they run an amazing lab. It's something that they're trying to always lab is challenging, so they're trying to bridge that gap. I'm part of KCK Dental now. My corporate days are over. So KCK is also celebrating 23 years in dentistry. So a lot of exciting times, and we hope to have a lot of interaction also during the lunch break. So welcome once again. Thank you.
Thank you so much, Mr. Ozzy, for the wonderful introduction. And it's really nice to be in Bangalore. I think it's just my second lecture in Bangalore for a very long time. He said enough about me. I'm a conservative dentist and endodontist. I prefer to be called as a conservative dentist because most of my practice survives on porcelain veneers. This is what I do for a living, if you ask me. A lot of porcelain veneers. And I'm also a big fan of composites. I do a lot of composite porcelain veneers. And I believe the future of dentistry is adhesive dentistry and adhesive aesthetics. So we are moving pretty faster. There's a lot in digital dentistry. We will discuss about how to even fabricate a bleaching tray using digital technology. So that's what we're going to do today. And my topic for today is on teeth lightening. I don't call it teeth whitening because you know the fact. So the moment you Google about teeth whitening, this is what you see. Correct? This is what patients also see. Everything is white, bleach white, veneers, or they are definitely morphed, and this is what they see, and this is what they expect when they come to you. Doc, can I get this white teeth? Is it possible? Right? So calling it teeth whitening itself, I believe it's a wrong thing. Maybe we can call it teeth lightening. That's the right term. And I just want to know how many of you over here are doing teeth whitening or teeth lightening in your practice? All of you? Almost many of you guys. Yeah, that's great. If I ask the same question in Tamil Nadu, I think like hardly 4 or 5 hands out. So because people have a fear of doing bleaching. What do you think it is? Why do they fear of doing teeth? Yeah, of course, first thing I'll get is sensitivity. You cannot handle that, correct? So the moment a patient says it's so sensitive, because they're coming to you thinking that they're in a spa, they're coming for a facial or something like that. So they just come just so relaxed, and imagine you give them some sensitivity on their teeth, they're not able to accept it. Got it? So this is where teeth whitening is something which is not accepted by most of the dentists. If you see, everyone does facial, right? I'm sure women over here, right? All of you do facial. What is it? It's again hydrogen peroxide. You're doing hydrogen peroxide on your face. But if you look into the data, it says every parlor at least does 3 facial in a day. But if you look into the data of dental clinics, hardly they do 1 whitening in a month. That's the ratio. Okay, so what I realized is, I will share my journey about teeth whitening, what I started doing, how all my silly experiences, even the bad experiences, what I'm going to share today. I'm from a very small town called Nagarkoil. I don't know how many of you know that place. It's a small town down south. It's in Kanyakumari. So that's where I did my schooling, and I came. For me, Chennai was a big city. So when I came for my college, and I was like, wow, this is Chennai. So, and I didn't want to go back, because I was so passionate about aesthetics, and I believe that, people in Chennai are only the ones who are going to do aesthetic dentistry, and if I go back to my town, I'll not be able to survive. So, I took the risk of, starting my practice all in Chennai. I started very small, and it gradually picked up, and I'm going to share my journey, okay? So, before we talk about the teeth whitening or teeth lightening, whatever, I'll just go to some basic. I know some of you might be knowing a lot, but let me just brush through a little bit of basics so that it's just going to recall or remind you of a lot of things. So for whitening, you have something called as vital bleaching and non-vital bleaching, correct? Now, with vital bleaching, you call it a professional bleach or a home bleach. What do you use for a professional bleach? Hydrogen peroxide. Okay, this is what we've been doing for so many years. It's hydrogen peroxide. For home bleach, it's carbamide peroxide. Clear? This is what we were doing. So how does it work? What is the mechanism of action? How does the bleach work? Where is it working? On the enamel or on the dentin? No, it's working on the dentin. Where is your intrinsic stain? It's inside your dentin. Okay, so your extrinsic stain is on enamel, and that can be cleaned, or you can do a polishing or a scaling. It's going to go off. Your intrinsic stains are actually absorbed at the dentin. So you want a bleach that has to penetrate through the enamel, reach the dentin. Okay, so when it penetrates, you have double carbon bonds. Okay, so they are colored stain molecules. They're double carbon bonds, and they break down to single carbon bonds because of the oxygen, right? From your hydrogen peroxide, it attacks, it breaks down double carbon bonds to single carbon bonds. The moment you see single carbon bonds, they are smaller in size, they will reflect light, they are too translucent, and they're so small in size that they can even diffuse off through the pores. So that's how you don't see the discoloration. Okay, it's very simple, just breaking double carbon bonds to single carbon bonds. So this is how it works. The moment you have hydrogen peroxide, it releases oxygen-free radicals, that penetrates, goes to the dentin, breaks down higher molecular weight particles to smaller molecular weight particles, and they become lighter, smaller, they reflect light, they just get dissipated. This is what happens with your whitening concept. So for vital bleaching, mostly what are we using? It is 35 to 40% of hydrogen peroxide. So you all know hydrogen peroxide is the key ingredient in bleaching. So earlier, I don't know, in any conservative dentist here, over here, conservative dentist, endodontist, you all would have heard about this Meckin solution, right? This 3 solution which we mixed and we were applying. It was the cheapest source that we were that was available. Why aren't we using it now? Because it just seeps away, right? It burns the tissue, it just seeps off. So that's when they made it in a gel form. Nothing but the modern bleach, everything is made in a gel form so that it contains the product inside and it's applied and it stays in place. That's all. Okay, so hydrogen peroxide, from that it releases its oxygen, it works on the tooth. The biggest disadvantage is nothing but the sensitivity. This is something which is, sometimes it's surprising. You won't even believe that it's going to be sensitive for this patient. You see that the enamel is all fine, it's applied, and you start working and suddenly the patient, oh my God, it's so sensitive. Right, so this is what happens. So later what they did, they incorporated potassium nitrate, sodium fluoride inside these gels so that the post-operative sensitivity was kind of getting lesser, right? So I'm just going to show you how I was doing bleaching those days. Okay, so the moment you do a bleaching, have you noticed that you give the mirror to the patient and she's going to look at that and they're like, no, I don't see a big change at all. Have you noticed that? Most patients will tell you that I don't see a change at all because they don't actually see. It's for us to understand that you might know that you have moved it from A3.5 to A1. It's very hard for a patient to differentiate between A3.5 and A1. Okay, so giving them a shade tab and telling them, see, this is how it was, now see, this is how it is, doesn't work. Everything has to be photographed. Documentation plays a major role. Okay, so this is number one thing that you need in dentistry is what I would say is documentation. Use a proper DSLR camera, take a picture, show it to the patient, tell them, this is what I'm going to do, I'm going to change this color. So first thing what you will do is, what do you do? Scaling and polishing. Make sure you use a oil-free polishing paste, okay, because you want to remove the biofilm, the smear layer, so that the bleach can penetrate inside, correct? So you use a oil-free polishing paste, scale it, polish it so well, and then you will do one at a time. What I used to do is, we used to do the upper, then for the lower. How many of you place rubber dam? One. See, this is where rubber dam plays a major role, because I never wanted to waste a lot of time on the chair. See, let's say earlier the bleaching time was 20 minutes. Okay, so we used to place it for 20 minutes, again wait, then wash it off, maybe make sure the patient doesn't put a tongue in between, doesn't close the mouth, all that you got to sit and watch. Why do you want to do that? 20, 20, 20, sometimes 3 cycles. You waste a lot of time. So just put a split dam. This is what I do. I put a split dam. Okay, split dam is so easy. Just slit it at the in between. Place 2 premolar clamps, stretch it and put it. The tongue is protected, lip is protected, it's over. Now I'll apply the bleach and I'll leave the place. We never have a separate appointment for bleaching. It's along with the other procedures. So I'll go back, start doing the next procedure, and the next sitting, after 20 minutes, we'll place a gingival barrier, of course, protect the gingiva, and first we'll apply the bleach. Okay, so then we use a cut suction tip, and we suck it out, and that's all done by my assistant and my assistant doctors. Okay, so I don't come back after that. I come towards the end. So it kind of saves a lot of my time and my chair set time. I don't have to sit with the patient for a very long time. And I always do the upper first, take a picture, show it to the patient, and then go for the lower. This might waste a bit of time, okay, but it will make your patient appreciate that you have done a job for them. Okay, so always do upper and lower. So this will actually help your patient appreciate. But somehow, whatever gingival barrier you apply, can you see a little bit of burn here? That's always there. Okay, so you have this Evian capsule. Have you heard about that? Okay, it's a vitamin E capsule. So you can apply that kind of actually reduces this burn. And this peroxide burns will actually go away maybe in half a day, so you can actually reassure your patient and send them. But when there is sensitivity, the patient is not even going to listen to you. This is where we were having problems. The biggest challenge in vital bleaching is post-op sensitivity, which, I would like to share one of my experience. I treat a lot of Middle East patients, guys from Iraq, Bahrain. They come with a translator. So for my bad luck, I was doing a bleaching for a guy, and my translator, he went down for a smoke. This guy was like jumping out of sensitivity, and he could not explain. So he was putting his hand. All I could understand is he's writing it in Arabic from left, because he was going left to right. He's abusing me. That's what I could realized. And I was like, okay, wait a minute. I'm calling the translator. He's not there. So so the problem is we could not even communicate to that guy that it's just sensitivity, will be all right. But he got really panicked, scared, and believe me, 2 years after that, I did not do any bleaching. On any patient, I did not do any bleaching because I was really scared that if there is a bit of sensitivity, because I lost a lot of clients, because these guys come by referral. I've done so many full mouth rehabs, many cases, and they come with word of mouth. And with this one patient, I actually lost a lot of patients after that. So I was like, why the hell did I do bleaching? This was something which I thought, okay, next thing is let's say a patient comes and asks me for bleaching. That's when I used to do home bleaching. Home bleaching is safe. We all know that, no post-op sensitivity. All we need is carbamide peroxide. We can fabricate a tray for them, put this gel inside, ask the patient to wear it. If it works or not, it's their headache. This is what we think. We are like, we can always blame the patient by saying, oh, you didn't wear it. You're supposed to wear it for 1 week. You didn't wear it for enough time. Maybe you didn't wear, I told you to wear it for 4 hours. You would have just worn it for 3 hours, something like that. No, you can always blame them. So, and nowadays patients are very smart. So they don't want this home bleach. They're like, you do it for me. Let's see. I'm not getting him. You do it for me. So, but somehow, if you look into all the studies, literatures, it proves that carbamide peroxide is actually safe because it's a very slow bleach. It works slowly on a long term, and the durability of the bleach is also better. The bleach is much better over a period of time. How does carbamide peroxide work? The moment you apply carbamide peroxide, again it splits into hydrogen peroxide. So again it is hydrogen peroxide. Remember that. Okay, so hydrogen peroxide is the one that is doing the bleach. It breaks down to hydrogen peroxide, 30% and urea. So every carbamide peroxide, 1/3 of the carbamide peroxide breaks down to hydrogen peroxide. Urea has a high pH value, so kind of you can avoid this post-operative sensitivity, so you get away with that. Okay, and also the concentration of hydrogen peroxide is less; it's gradually released, so you don't have this post-op sensitivity. Okay, but the problem is, what is the problem? Long-term, usage. So the patient has to wear it for a week or more to appreciate it. So how many patients have you followed up by doing a carbamide peroxide bleach? You cannot follow up. People are coming to you because it's their priority that day to get some teeth whitening. So you give them a bleach and you ask them to wear it every day for 1 week. Maximum 3-4 days he'll come to you, or maybe he will report to you, he's going to tell you. But after that, he has different priorities, different things in life. They will stop using it. And this has always been happening in my practice. I've always seen that there's no patient who is wearing this long-term carbamide peroxide at-home bleach and showing you that, I have got some result, doctor, I'm very happy about it. No one has ever told that. So, again, carbamide peroxide, 5 to 8% has to be used 8 hours daily. 10 to 20, 3 to 4 hours daily. Probably this 10 to 20 kind of works. You cannot ask a patient to wear it 8 hours a day because he should be highly jobless to do that. 8 hours a day. Okay. So 3 to 4 hours is kind of okay, great. Anyone can at least watch a movie every day and just sit and watch, wear it on. That's it. And again, as I said, this was the same problem we had. Patients don't, follow up. They don't. I usually ask the patient to use the upper first, finish it off, come back later, and get the gel for the lower. We used to have 4 gels, and we give them 2, fabricate the tray for them, ask them to wear the upper, and once the upper is done, then come back and let's do the lower. This is what we used to tell them. And remember, this is a very recent article, 24, last year. What they found was, why do you need 35% hydrogen peroxide? It's not making a big difference. 37% of carbamide peroxide is similar to 35% of hydrogen peroxide when it's used as an in-office bleaching. This is a systematic review. And I kind of, being a clinician, I don't believe in individual studies. I believe in a systematic review. And this is what it says. So why are we actually using a hydrogen peroxide, creating post-op sensitivity, burns around the tissues? It doesn't make sense at all. So carbamide peroxide was always better. But the only problem with carbamide peroxide was it has to be used for a long term. So this was a challenge which we used to think how to go about it. So that's when this power bleaching concept from Blancone was launched, which had 16% carbamide peroxide, which is ideal, right? So this 16% of carbamide peroxide could do a bleach. So when I was in Dubai for an ADEC conference, I met Joseph Lipani. So I was seeing him doing live bleaching on patients, on dentists who were walking in. He used to do the bleach, wait for a while, they get beautiful results and they just keep walking out. No post-op sensitivity, nothing. I was the only guy standing in that stall for a very long time and just looking at what he's doing. And then I went and spoke to him. How is it happening, man? I'm not at all confident to do a bleach. Okay, and how are you able to just keep doing it and you're sending patients, you're just doing on chair? He said, no, there is no post-op sensitivity, trust me. Then I was like, I didn't trust him. I was standing there. Every patient I used to ask them, how is it? Do you have any sensitivity? No. I was like doing a complete survey over there. And then later I went to him and said, I want this unit in India. They said, there is nobody in India. Then I was like, no, there should be a dealer, right? Then they said, just yesterday, there was one person, Mr. Shebin. That's when I know Shebin's name. He had written it in a paper and he showed it. Mr. Shebin is the dealer from yesterday. So they might bring it to India, then you can be the one to buy it. And I wanted to buy it badly. I just really wanted to get it. Then when I came, I called him and he said, sir, just give me some days. Once I launch it, I'll give it to you. So once it was launched, I think I was the first to get it. And I started doing it. My practice on bleaching totally changed because zero sensitivity, no gingival irritation. It was like, a big surprise for me. My patients were so much enjoying because I used to intentionally call patients who have already done bleaching somewhere and have a bad experience. So those kind of people, the moment I do use Blancone on them, they're like, how come there's no sensitivity at all? That's what. It's an Italian product, that's how it works. And I'm sure they would have gone through a lot of research to get this done. And guys, we are the only ones who are using 35% hydrogen peroxide in India for a very long time, causing post-op sensitivity, tissue burns and all that. Do you know that in Europe, they have regulations that their Cosmetic Dentistry Act has a regulation where they should not use more than 6% of hydrogen peroxide in their practice. I don't know whether it's a good thing or a bad thing. In India, we have zero regulations, so we can do anything we want, right? But anything that goes really wrong on the patient, and that's when we have to face it. So I kind of look up to the West. I always see what these guys are doing and try to follow something and set some regulations at least for our side and keep our patients safe. So I believe this 5%, when this in this Blancone, you have this 10 to 16% carbamide peroxide, which can break down to 6% of hydrogen peroxide. So that's why you're not having a post-operative sensitivity, no tissue burn, nothing. So I was always having this thing in mind, like how is this carbamide peroxide actually working so fast? So it's all because of the high intensity lamp that they have. Okay, they have used an Arcus lamp, which has 50 watts bulb, and you have around 10 bulbs. Each are 600 milliwatt per centimeter square intensity. It's a really high intensity. So you place that 5 centimeters away, apply the bleach, just switch it on and go to the next one. This is what I do. Sometimes I just tell the patient, I have my chairside assistant always there. The patient says that it's a little warm, slightly move it away from them. That's it. Most of the patients don't tell anything. Okay, so we just do 3 cycles. I usually do 3 cycles of click. In click, when I spoke to Joseph, I said, I do it 3 cycles for a patient. He said, impossible. Click has only this much material. I do 1. I said, in India, we do it. I know how to do it. And I showed him. I saw him doing. He applies a lot. I told him, no, Joseph, I apply half of this because all the bleach that is in contact with the tooth is going to work, I said, no, you got to apply so much. And I said, no, I apply less. I make it a point that it comes 3 cycles for each patient, at least 2.5 cycles. So I was asking Pawan, are you able to get it 3 cycles, 2.5, from premolar to premolar again, right, upper and lower. So that Blancone click alone works. You have something called Blancone touch, which comes for 3 cycles for them. For me, it comes to 6 cycles. So I use it double the time. So, and I've never used Blancone touch, and I've never gone for 6 cycles. It's lot of heat. You're placing the light for 6 times. It's when you cross the 3rd cycle, that's when the patient will say that there's little warmth over there. So, can you keep it a little away from me? So, post-op sensitivity has always been 0. This is the lamp. So, last time, even in the previous course, there many of them was, why can't I use some other lamp and use your same bleach? Will it work? These guys are smart, of course, right? Bleaching is, their product is going to work only at this intensity, where you need 600 milliwatt per centimeter square in each bulb. So you have 10. Okay, so it's actually, it's already designed by them, so you cannot do anything other than that. And first thing, when I got it, I wanted to experiment on a patient. This guy who's lying down is me. I would have not sat like this when I'm going to use a hydrogen peroxide. Okay, so I just thought, let's try. This is my teeth. I have a bit of abrasion here. I come on an A3. So I thought, okay, let's try working on me. And I told my assistant, apply it exact on this. I want to know how sensitive it is. She applied it exactly on that. Okay. If it was another patient, I usually block it with the gingival barrier. That's what we usually do, right? We block that with the gingival barrier and we make sure that gel is not on that. But here I applied it on that. I never had a sensitivity. Okay, I applied it on that. I never had any sensitivity. Once it was done, is there volume? And she was newly joined a dentist in my clinic. So she was so excited and she's going to treat me. And she's like, sir, are you sure? I said, you just do whatever you want. So she's like, it was like a pride for her. She just, what did she applied? And I said, okay, you just do. Okay, so what we use here is touch. Just have to connect them. Just start mixing it. Okay, 50 times. Just push it here and there, and you get a nice single consistency of nice red, dark red consistency. Attach the tip to it, and just first thing is you do a little bit of scaling, you do a polish and all that, and then remove smear layer, all the biofilm, and then just apply it all over. Okay, so you can see she's applying it on my canine, on the erosion. So I have zero sensitivity. Now we keep it 5 centimeters away. Okay, sometimes 5 centimeters can be a little warm, but I prefer keeping it closer. If the patient says it's a little warm, we keep it away. I wanted to feel it. For me, I was okay. I did not have any. And always have a cut suction tip. Just take it out, wipe it, go for the next cycle. And usually you will have the bleach stuck interproximally, so just use an applicator tip and just wipe it, clean it off. Again, we went for the next cycle. Okay, and from A3 it moved to A1. This was my result. Okay, if I had a quite polished teeth. What I observed with bleaching over a period of time is if you have a nice polished tooth, a well glossy polished tooth, the bleach you have a 2 times jump in shade. Okay, if it's a little more porous, a fluorous teeth or a little more porous, the bleach effect is much better. You even have 6 times jump. So this is how it works. Okay, because there's better penetration, better absorption. Okay, so that's how it is. See, these are my other results. Another patient which I could get it from C2 to A1. Okay, C2 to A1. Blank one again, A3.5 to A2. These are all just in one sitting. No post-op sensitivity, no gingival irritation. Just apply it, leave it. It is 8 minutes, 8 minutes, 8 minutes, 3 times. Okay, so this is another case where you can see. Okay, this is from A2 to B1. Okay, so A2 to B1. Again, see this A3.5 to A1. Okay, so this is the same that you see. Now I want you to understand. Just check all my cases, and you will find something actually gone wrong in those. The whitening is perfect. No post-op sensitivity, no tissue irritation, all fine. Go back to this. From here, okay. See this. See this. Tell me what is actually going wrong. No. Huh? Can you see this? Something actually. Color of the gums, exactly. So this is what I called Joseph immediately, and I told him, boss, everything is fine. The gingiva color is slightly getting darker. Patient is not complaining. None of the patients have complained, because when they see the teeth is white, it's like a nice contrast, so they are very happy with it. And they're like, oh, nice white teeth. But when I see the photograph later, I saw that the gums are slightly darker. He said, it's impossible, it can never happen. I said, no, it's happening. I shared all the photos. See, I have a little bit of gum color change. So, then I got a German guy. This guy is a pilot, okay. He's a German guy. He came for a bleach. There is no change in gum color. Because we have melanin. Those guys don't have anything. So I immediately called him. Joseph, you're working only in Italy, and there you guys have no melanin. We have melanin, so there is a color change. So he said, wow, yeah, really. I saw this in one patient when I was doing a demo in Dubai. So that's when he opened up. He said, yeah, I was stunned. Why is it happening for them? Oh, you guys have melanin. For them, melanin was something new. And that's when, then we were like, okay, so what to do about it? Okay, so we are doing a lot of research right now. We are in the research stage. So he said, okay, how long is it taking to reverse? for my patients, when I followed up 3 days, it's back to normal. Maximum third day, when they come, it's back to normal, and the patients are not aware of any change in gum color. But if you want to be more protective, you can apply a little bit of gingival barrier and work. But I still don't. Okay? But I don't want the patient to have, because it's a high intensity light, right? Because of that intensity is just like a sunburn that you get, suntan, right? So what I immediately called Shibin, and Joseph told me that you wear a lip retractor, because all this while I used only a cheek retractor. Because when it was launched first, they did not get the lip retractor, and we used only the cheek retractor. For this guy also, I used the cheek retractor, but there was no change in color. Okay? Then I asked Shibin, and he sent this Blancone's cheek and lip retractor, and so that you don't get black lip on your patient. Okay, so I apply this lip retractor and have a nice face shield. Okay, this where you can just apply it, and so that there is no skin tan as well. So these two becomes very important. You have to apply them, and then you work on the patient. Okay, and remember, for bleaching, this is your shade guide. No, all of you using this Vita Pan Classical shade guide, which is arranged based on the hue. A is one hue, B is one hue, C is a hue, D is a hue, right? So this is how. So it is, all our shade guides are arranged based on a hue. So once you go back, all you have to do is rearrange your shade tabs. Rearrange them like this based on the value. From B1, then A1, then B2, D2, so on. Now you see, this is from a higher value to a lower value, because our eyes are more sensitive to the value. It's easier for you to do any shade guide, even for your veneers or your crowns or whatever. Always rearrange your shade tabs like this, so it's easier for you to actually do a proper shade match. And also for bleaching, this is how you assess what are you working on. When you're doing a bleaching, you're increasing the value of the teeth, right? You're not changing the hue or chroma. You're increasing the value of the teeth. So if it is C2 to, if I'm getting something from C2 to A1, it is like 1, 2, 3, 4, 5 shade jump. Okay, this is how you say. Based on the value, you have to calculate how many times you are able to jump a shade. So first thing is rearrange your shade tabs, and even with that Blancone kit, you get a shade tab which is arranged based on the value. Okay. And this is one of my patients.
Ta-da! So I finally got my teeth whitening done.
She was someone who's really scared of teeth whitening, but she's heard about sensitivity and all that. So when she came, I said,
I was actually, we had spoken about this before,
be
because generally I am a big coffee drinker. When I was younger, I used to drink about close to 3-4 cups of espresso shots all the time. And my dentists before have always said that your teeth are getting stained, Pooja. I didn't realize it until much later that there's a nice big yellow mask over my teeth. After this procedure, it just feels like I was telling doctor that this is it feels like this is the first time I've brushed my teeth, because I finally see white teeth. And it was a very nice, not very long, not very time taking also, but very patient. You have to be patient with it, but pretty easy, pretty painless. I usually don't do anything that orally changes the way I look. This just makes it a little bit more perfect. I'm really happy that I did it with Dr. Arun. He's really patient and really good, and he properly explains each step along the way. So you're sort of in your head, you're a little calm about what's happening. So I'm happy with it. And how do you guys like my smile now?
So when you're using this Blancone, first thing is clean, polish your teeth with oil-free, fluoride-free polishing paste. This is the first step. Second is use your Blancone cheek and lip retractor for better protection. Then mix the bleaching syringe and apply it over each tooth. Place the Arcus lamp close to the retracted teeth and initiate it. I would say 5 centimeters away. That's ideal. And then set it for 8 to 10 minutes each cycle. 8 minutes is what I use. Okay, so 8 minutes, I feel it's more than enough. Sometimes you can even set it to 10 minutes. And you can set it to 10 minutes, so it stops by that time. Okay, so you, as I said, you can go to the next room, you can check your other patients. Wash the bleach and reapply it for other 2 cycles. So this is something which you don't have to be there, You can just apply it, go to the next room, your assistant doctors can manage it. Probably your patient will always want you to initiate it, right? That's how our patients are there. Emotionally, they come for you, so they want you, doctor, do it for me. So first application is me. Next is, my assistant doctor. So at the finishing, sometimes, I just go and I finish it off. That's all. That's how it is. And I'm actually scared that, when anyone can use this, I'm scared that they shouldn't be giving it to the parlors and all that in future. Then you go to a beauty parlor, they'll be like, you want to do a Blancone bleach? It's going to be a shock for us. And, you see her transformation, we moved it from D3 to A2. But, see, she's got some fluorosis. This is one thing, which later she asked me, Doc, I see some white patches. This is already there. As I said, I am a fan of porcelain veneers composites. For me, if it is fluorosis, it is porcelain veneer. The patient goes directly for porcelain veneers. Okay, but with bleaching, sometimes your fluorosis, whatever is there, can be a little slightly exaggerated. So that's what, when I asked the Italian guys, they said the recent click is coming up with nano hydroxyapatites in it, so that you don't see this, white flecks of hypomineralization. So, but this is actually not a big complaint because the patient actually wants white teeth. So this will not be a big concern for them. But this is what I noticed, because when I do veneers, I like that uniform white color, right? This is what we want. As a dentist, we would like that. But with any bleach, this is what gets exaggerated. The white flecks get exaggerated. Okay, so this is the same thing whatever I said, but the thing is, finally for maintenance, you can always ask the patient to continue with this Blancone Home Fast. Fabricate a tray for them, okay, a bleaching tray, fabricate a bleaching tray, show them how to apply this, and they will wear it at least for 10 to 15 days, okay. And more they wear it, it's kind of, as I said, carbamide peroxide, when you apply it on a long term, okay, the durability of the whitening is also increased. Patient has long term better whitening effect, and that's the best part of it. So you may have to continue with Home Fast over a period of time. And to make these bleaching trays, you give it to a lab, right? You take an impression, give it to a lab, ask them to fabricate a bleaching tray. I don't know, initial days, we had a struggle with the lab guys. I don't know how it is over here. They will just make a S6 retainer and give it to you. The moment you put the bleach and you apply, the bleach is all over. Inside is sulcus. Then I'm like, what are you doing? You need to have a spacer there. Okay, so these guys, many of them actually didn't know that. So what you have to, tell them is, you should have a lab composite. There's something called as a lab composite which you get from Ultradent. On the model, they apply it exactly 1 millimeter away from the gingival margin. This is where they have to block it, not along the margin again. Okay, so when they use it 1 millimeter short of the margin, and when they press or fabricate the tray, okay, the tray will exactly seat over here. It will prevent the seepage of the material. Okay, so this kind of something which I tell my technician to do it, and then probably after that they started doing it well. So you use a hard 1 mm sheet and you vacuum press over it, and you get your bleaching tray ready. Make sure it's cut around the margin, no excess. These are certain things, sometimes the lab doesn't do it, or you can actually trim it off. So I'm going to show you another technique. Okay, so now we are all into digital. Yeah, please. You can have it up to 1.5 to 2 millimeter volume for the material to contain over there. 1.5 to 2 mm thickness, buccally. Oh, you mean the sheet thickness is 1 mm, hard splint. Okay, so now we are all in the digital era. As I said, to ask your lab to do it. How many of you use a scanner? Almost all of you. Medit, how many of you use a Medit? Very few. Just one person. 2, 3, 4. See, in Medit, I don't know how many of you know that, there's something called as a model builder in it. Okay? So using that model builder, you can actually just add onto the existing scan, and you can print that model and you can fabricate a tray. Now you'll see what I'm doing. We're just taking a scan of this patient. Okay, we're just going to scan her teeth. Reduce the volume a bit. So now you got the scan. Okay, on the scan, using the model builder, I can just a tool over there, model builder, and just click exactly 1 millimeter around, and you can emboss it. You see that? I'm just creating a little bit of embossment on that scanned model. So just touch over it. It's just hardly few minutes. Just emboss it a bit. You can do it yourself. Okay? And I'm actually increasing the volume of each teeth. But don't touch, make sure you're not touching around the gingival margin. Exactly 1 mm away from the gingival margin, and you emboss it. Again, you can see a bit of volume over there. Okay, now you can print the model. So, and this is what my technician is doing. He's putting the sheet, and you press it. Get the sheet out, cut it outside, remove the tray, and as I said, all this excess has to be trimmed exactly around the margin. Okay, so trim it exactly around the margin and ask your patient to wear it. And if you see very close, can you see that little bit of space here? So this is all just done. I just created this spacer by designing the model that way. Okay, so you get this. I'm just fitting this on the pre-op model. We printed 2 models, a pre-op model and a post-op model after doing the model building. So when you see, you will see this much of volume of space over here, and it fits exactly at the margins. So this is a very easy way of doing bleaching today by yourself. I have this model builder in Medit, and of course I think other scanners will also have it. With ExoCAD, it's much easier also. If you have an ExoCAD software, it's again easier. Lab to do it, yeah. So, but the thing is, the lab guy has a good idea about how to do it, and yes. ExoCAD, you can actually, while embossing it, you can have a colored embossment so that you will know exactly whether you have moved 1 mm above. Okay, so we all can't afford buying an ExoCAD, and unless you have a lab, buying an ExoCAD and having it is not going to work. Maybe you can just give it to your lab and ask him to do a digital fabrication. All right. So coming to something called non-vital bleaching. All of you clear with this vital bleaching part, no? So we moved from the conventional vital bleaching, then we have come to this Blancone vital bleaching. A lot of cases, and I'm telling you, that experience with your patient is going to be great. No post-op sensitivity, they're going to enjoy it. And bleaching in your practice will be like every day. So what we do is, it's a part of our oral prophylaxis. Like we have it, this is what we do in our practice. A patient wants, whoever is coming for scaling, if they want to do it along with a little bit of whitening, we add a package to that. So most of them will want a little bit of white teeth. Yes, yes. No.
Yeah. How about the internal stains, where we have the stains and enamel, the incisal margins? How about the efficiency in that cases?
Yeah, you can apply the gel interproximally as well.
Not interproximal, incisal regions.
On the incisal edge, you say?
There will be internal stains and incisal regions.
Oh, okay, on the incisal, yeah. You can apply. Unless the wear off is too much, then I would not advise it. But otherwise, I have another case which I can show you. Severe wear off. It kind of works, but still you will see that slight bit of difference. But again, you can't keep applying for a very long time, and that again is going to cause some sensitivities. It's just 3 cycles, right? With 3 cycles, you will see a bit of change in color. I'll just show you one case which I think. I'll probably show you at last. That was a severe attrition, severe class 5 V-shaped defects and all that. I did not apply inside the defect, but I applied it all over 3 cycles. He did not have any post-op sensitivity, but I shouldn't lie, towards the 3rd visit, towards the end, he said it's little slightly sensitive, but it was not, he wasn't actually complaining. When I kept asking him, aren't you feeling even a little bit of sensitivity? He said, slightly I feel a little bit of sensitivity towards the last. That's all. Till then, none of my patients have actually told about any sensitivity. Yeah.
Sir, when doing the bleaching, if the gums get pigmented, as you have shown, how many days it will take to...
No, that pigmentation hardly 2-3 days. Just wear off, wears off. Just like a suntan, 3 days you're back to normal, right? Something like that. Yeah.
For how long it is?
Any bleaching, let it be. It again depends on the patient's diet and a lot of other factors, right? So it's something similar to that. If you ask me, my experience, that one German guy, he's a pilot. He is someone who does bleaching every year in any part of the world, wherever he's a pilot. So wherever he travels, he says, I get bleaching and I maintain it for that 1 year. He's very, very focused on his diet, he's disciplined, and he says, I don't have anything. Because their diet is like that, and he kind of maintains his teeth. But I don't see that with most of our Indian patients, because they maximum 2 days is what they can be without, our colored diet. After that, the turmeric to whatever, everything can kind of stay in their teeth. So that's how. And if you see, according to studies, it is like 1 year is what you can maintain the bleach. Okay, and definitely, if you ask me, if the patient wants it for a longer time, they have to be on, these maintenance, carbamide peroxide bleach, and all that to maintain it for a very long time. Diet plays a major role. Yeah.
They can have a home bleach once in 3 months, 6 months.
See, actually, Click advocates 6 times a year, which none of the bleach actually advises. We say it's just 1 in 2 years or something. But according to them, they say 6 times a year you can apply it. You can keep doing the bleach. So, because it has zero sensitivity, it's not going to cause any reduction in enamel micro hardness. So, this is what they advocate, but I don't know whether we still need time to, think about it, but this is what they say. You can do it for more time. Yeah.
Can we apply for any classified areas?
Yeah, over composites, there will not be any change of color. So, if I am doing it on a composite, it won't change the color of the composite, it's just going to change the color of the tooth. Later, you will have to change the composite, any bleach to it. It's going to have a shade mismatch after you do the bleach. So, once you do a bleach, any previous restoration has to be changed.
Is it like
Compulsory, because they have designed it that way. Okay, so see, any company will do that, right? Because they want you to stick onto their product. So, it is made like that, so you can't help it. Yeah.
Tried it on heavy smokers.
Heavy smokers after scaling, yes. After proper scaling, polishing, and then it works. And again, if they smoke, it's up to them. Yeah. Most of them say, doc, this is the last day I'm going to smoke, so you do the whitening. Again, next year you will see him. The same.
It should be accompanied with the home bleach, right?
It has to be accompanied with a home bleach if you want to maintain it. 15 days again.
It works on the fluorosis teeth.
It does. I showed you, right? So it works on fluorosis teeth, but any bleach on fluorosis teeth, this is what I was telling you. That white patch that you see is something where it will remove the discoloration, but you end up seeing those white patches. So, as an aesthetic dentist, if you ask me, for a fluorous case, what you would do it? I would go with a composite veneer or a porcelain veneer. That actually makes sense. It gets a nice, even, nice color.
So the black one executive came to me. He
Yeah.
told that a fluorosis teeth we can bleach with a touch. It works.
Touch and Click are the same. Only thing is touch has the quantity is a bit more. You can go for 6 applications. Click is only 3 applications maximum, or 2.5 applications. So that's the difference. You have to apply it for more time. More than that, you have severe discoloration and you want to work on it, you have to go with Blancone's Ultra. There's something called Blancone Ultra, which I'll talk about it. That's similar to your 35-40% hydrogen peroxide, where you have to protect the gingiva and do all that. And it's really, really effective. Okay, if you really want that real whitening and if you are okay with that post-op sensitivity, then Blancone Ultra. To be frank, I have not used Blancone Ultra on vital bleaching. Because for me, I don't want my patients to complain on post-op sensitivity. I'm very clear with that. Let's say if I'm able to get 3 shades jump and the patient is appreciating, that's more than enough. Rather than causing sensitivity with a nice frosty white teeth. Does it make sense? Okay. So my Ultra, I'll tell you where I'm using it. I'll show you. Yeah, please. Yeah, you should follow it up with a restoration. Post bleaching, you have to plan with composites or porcelain veneer after 3 weeks. So I will talk about that. Once you do a bleach, okay, and you say your patient has some pitting and all that, and you have lightened the shade, stump shade, and then now you want to, restore that, you will have to go with a composite or a porcelain, right? So you have to wait for 3 weeks, because all the residual oxygen that's inside the tooth takes 3 weeks to get eliminated. Okay, because this oxygen will not allow your composite to polymerize or your veneers to bond onto it. So you need to wait for 3 weeks. So yeah, you can always restore post bleaching. That's what I do for most of the cases. I'll show you a few. How many of you do non-vital bleaching? 3, 4, yeah. So non-vital bleaching is actually a magic which we can create in dentistry. Okay, this is like a magic. Because I have seen patients, and someone in your relative will be there that with that one yellow tooth, be roaming around for so many years, and he'll be known for that. They're known for that. That yellow tooth uncle, yellow tooth auntie. So this is how we name them. So they are comfortable with that, because wherever they go to any dentist, that dentist would have told you have to chop it down and go for crown. Correct? Who would want to do that? He's like, I'm okay with the color, man. I'm adapted to it. So this one single tooth color, even if he had gone for a crown, you think he is going to be happy with that crown? Can that crown exactly mimic the texture, the shape? No. Just a simple non-vital bleaching to change the color in a matter of 3 days. It will be like a magic, and the patient will be like, Doc, what is this? I never knew there was a treatment like this. I have had patients appreciating so much. They'll be like, because this is an instant gratification. Because the moment the patient goes out and he sees his relatives or his friends, anyone is going to ask, hey, what about that tooth? I went to this guy. This is the best marketing I have seen. Okay? And none of the dentists would have given this option. I've been doing this for more than 10 years, and any patient who, they'll be like, no one gave me this option. They only told me crowns. And zirconia crown is what they'll say. One zirconia crown, can you exactly match it to the adjacent tooth? Never. Zirconia for anterior itself is something which you have to avoid. Okay? Just do a single non-vital bleaching and finish it off. Send the patient. He'll be so happy. And see this. There are many patients. This lady has so much money that she can do porcelain veneer. She can close this gap, all that. But she's very clear. Doc, I'm okay with it. Just change the color for me. Have you seen patients like that? They are okay with it. And you cannot just try to convince them, no, if you close the gap, you're going to look good. No. Aesthetics is their own perspective, right? If they are happy with what they have, just leave them. Don't convince them. With aesthetic dentistry, that is one thing. You cannot convince a patient and tell them, you're not good with those gaps, close it. And then you somehow demotivate them and try to convince them just for that 2 veneers. And once you close, you'll be like, I was good before. That's it. My wife likes that gap. Now I want that gap created. I had, after my course, one of my students, she went back and she was so excited. She called her auto driver and she's like, Anna, you have this gap in between, I'll close it. Somehow she dragged him, she closed it. Same thing. He went back and said, just open this. My wife likes that gap. She said she married me only for that. Then she called me, sir, I closed it. I did a nice veneer. I said, never convince a patient for aesthetic procedures. A patient will show you, he will be having a demotivated smile. He is the person who you have to work on. Any person who's trying to hide his smile, who's not confident with his smile, or if he has some social pressure, like, wife is not liking it, the boyfriend is not liking it, something like this. These are the only reasons, they will come to you for smile design. Otherwise, don't ever disturb anybody. People are happy with that little bit of rotation, little bit of spacing, they're happy with it. Okay, so this is something which we should understand. And this lady, even if I had done a crown, my lab guy, what he would have done? He would have tried to close this gap, screwed up the proportion, and tried to give me a good. No, patient would have not been happy. Can I exactly mimic these textures, these incisal effects with a crown? Impossible. All I have to do is just do a non-vital bleaching. Just change the color. Just say I can just restore everything, all the details that is there in the tooth. This is the beauty of non-vital bleaching, which most of us are not doing it. I'm going to show you how easy it is. I'll give you 2 options. Okay, A quick fix and a delayed fix. Okay, so what we were doing for so many years is by just using sodium perborate, just closing in between, inside the chamber, call the patient. After 3-4 days, remove it and you will see a beautiful white tooth. This is restoration. And don't charge the patient so less for this just because you didn't put a crown. We have a habit of calculating it based on the cost of the lab. It's like lab cost is 3,000 rupees, so I just have to charge 6,000, 7,000. Okay, now for a sodium perborate, it's just hardly 5 rupees. So can you charge 15 rupees for that? You're doing a biomimetic therapy. You're doing a biomimetic solution for your patient. So your procedure cost should be equal to that of a crown. Okay, you should charge equal to that of a crown. See, now let's see what are the reasons for discoloration. Number 1 is pulp necrosis. Number 2 is intrapulpal hemorrhage. That is when you have been doing root canal and you want to do a single visit and you will see blood coming out after putting the GP and then you will it's okay. Just share it, seal it, send the patient. 100% the tooth is going to discolor. Okay, and your endo is also going to fail. So intrapulpal hemorrhage is something which you have to look into. Pulpal necrosis, pulp tissue remnants after RCT. If it's not a good, well done root canal, you will have all the pulp tissue remnants inside. So always when you are going to plan for non-vital bleaching, make sure you have done a good root canal. Even if it is done somewhere, I make it a point that I retreat the tooth. I retreat because I don't know whether there is any pulpal remnant. I don't know whether the proper cleaning and shaping was done, whether the previous dentist has used hypochlorite to clean or irrigate the canal. So a lot of things which we have to look into. Okay, so make sure you do it and then plan for a non-vital bleaching. Again, endo materials also play a role. If let's say the patient has an amalgam restoration previously over there at the entrance filling, there's an amalgam that can also change color. And root resorption, aging, these are all causes for tooth discoloration. Okay. Now, what are the bleaching agents that we use to do a whitening of a non-vital tooth? Number 1 is hydrogen peroxide, carbamide peroxide, and then sodium perborate. I will give you 2 techniques. Okay, sodium perborate is what we've been using for so many years. Easily available. It comes in a powder form. This much of powder, sometimes you will get it for 500 rupees, 300 rupees. But nobody will sell that because he has no margin. You have to find out somebody who's, some pharmacy guy who can help you out and he will, source it from somewhere and give you. Because there's no big margin for them. So sodium perborate of this much is 500 rupees. All you need is a pinch of that. Okay. I'll show you 2 techniques. Walking bleach is what we've been doing for years, right? Walking bleach, which is multiple visits. Second is an inside out single visit technique. We'll see these 2. So for a walking bleach technique or a multiple visit, what we do first is try to isolate the tooth. If you're not placing a rubber dam, at least have proper cotton rolls around. Okay, isolate the tooth and remove all the remnant restorative materials from inside. Okay, all the remnant restorative material and clean the pulp chamber properly with sodium hypochlorite first. And you have to shear the GP a bit below, 1 to 2 millimeter below the orifice. Okay, below the orifice. 1 to 2 mm below the orifice. Use a Gates Glidden or a piezo, whatever you have. Just slightly shear it below. And first thing is you will seal it with glass ionomer cement. How many of you are using a capsule GIC? I'm using a capsule because it's easy to introduce at the orifice level and then you can just slightly inject it. So a capsule GIC works. Otherwise, a GIC with a hand plugger, you can place it deep inside at the orifice level and condense it so well. You are creating something called as a cervical barrier. This GIC, once you place it here, you will condense it with a hand plugger and your GIC moves towards the walls and you should not have any glass ionomer sticking onto the labial part of the coronal chamber. Okay, so nothing on the labial aspect. Make sure everything is scraped off and you condense it and it moves towards, because you want the bleach to penetrate, okay, from inside towards the labial and create a good bleach. So this is something, most people have this problem. They'll say, no doc, I'm not getting a whitening. Why? That's because you have GIC all over here. It will not work. Okay. The cervical barrier is very important. Once you apply this, you will place your sodium perborate inside. You will place the sodium perborate Inside you will mix it with distilled water, okay? Take it in an amalgam carrier and just place it inside, that's it. And then take a cotton pellet, stuff it inside. Now close it with GIC, not IRM. Textbooks will say IRM, but I would not recommend IRM because it is releasing a lot of oxygen inside and it will just pop out your IRM. IRM will just easily come out. So at least glass ionomer, you can apply it, leave it for a while, give some finger pressure for a while, and all the excess of GIC should be all around so that it sticks. I usually use a pink GIC because for every visit I'm going to remove it, right? I'm going to keep changing the solution. So if I have a pink GIC, it's easy for me to selectively remove it so that I don't damage the tooth structure. So a pink GIC would be an ideal thing. So now keep changing the bleach once in 4 to 7 days, not more than that. Not more than that. This is dangerous if you leave it for a very long time. When I was a postgraduate, back in the year 2007, I had my first non-metal bleaching case. We placed it, and you know how it is. When being a postgraduate, you have so many patients waiting. You make them wait from morning 8 o'clock to evening 3 o'clock and all that, so they're not really happy to come to you. So I had a patient, I placed it, I sent him, I told him you have to come after 4 or 5 days. So usually what we do is exactly the 5th day we call the patient for a follow-up. And if there is a slight change, okay, we can, but still you have to clean it, place a fresh solution, again pack it with GIC. The cervical barrier is still there, okay, just change the solution alone and again go with a new entrance filling. So this patient never came back. He never came back. He said, yeah, there's a nice change in color and I'm very happy, cut the call. I said, no, you have to come to change it. No, he said, no, it's okay, I'll come again. Then he thought I want to document, that's why I'm calling him, and he got so bugged and he never picked up the call. In my 3rd year, he came with cervical resorption. We had to extract the tooth. Okay? So remember, once in 4 to 7 days, the gel or the pack has to be changed from inside. You have to clean it properly, thoroughly, and then place a fresh solution. Okay? And again, pack it maximum 2 to 4 visits. I do 3 visits. Within 3 visits, you will get a nice change. So 3 visits once in 5 days, it's like 15 days. So walking bleach is actually a long process. Okay, but the result is great. Patient is really happy. As I said, the complication and risk can be cervical resorption. It will reduce enamel micro hardness, of course, a bit of bleach, because see, rather than doing a crown, someone was actually telling me, doctor, you should, I always preferred going for a crown because non-metal bleaching will, reduce enamel's micro hardness. For a crown, what are you doing? You're removing the enamel, man. Okay, this is always a better solution. Okay, so external cervical resorption is one thing which you should be careful. Then it will interact with the addition of another restoration. It will damage the existing composite restoration and dental materials. Finally, sensitivity when it comes in contact with the adjacent teeth. That's why I said you have to protect it really well. Okay. Now let's say instead of doing a walking bleach, calling the patient 3 times, let's say I'm able to just do it in 1 visit. It's like a magic, no? The patient comes and you're like, wow, how is it happening? He comes with a single discolored tooth, and the moment you give him a mirror, there's no discoloration. He's really going to be surprised. See this case. This guy came to me like this. He can't even smile. Ask him to smile. This is how he'll have a restricted smile, and this is how his lips are so tight. I could not make him smile at all. So he said, I'm very embarrassed with this tooth, and can you do it? For so many years I'm having this. Can we do something about it? And this is how it is. Discolored central incisor. Now what I did was, I'm going to use Blancone Ultra. So as I said, that's again 35-40% of hydrogen peroxide. So I have to protect the gingiva. So I have a gingival barrier. Adjacent tooth, I use the Teflon to protect. I open the entrance filling. So I have a opening here. So I'm going to apply the bleach inside and out. That's why it's called as an inside out technique. You apply it on the inside and as well as on the outside. And now I'll use my Blancone Ultra, and I use my light to activate for 8 minutes. 8 minutes, keep it over that. Light activation. Post light activation, can you see this change in color? This is what you should observe. You should get a slight change in color and a little bit of effervescence on that. That means the gel is reacting. Okay, so once I got that, this is the color. So within 24 minutes, 8 minutes, 3 cycles, And he showed the mirror to the patient. And he's like, wow, doc, come on, how did this happen? For 25 years, I'm living with this. And then, this is before, this is after. But now, can you notice there is some composite over there? Yeah, so I send the patient. Let's say I know he's going to come back and ask me for change of that composite. So he's same like that. I told him, no, you have this composite which you may have to change it. So probably we will do it later. So he got a nice result. He's so happy. He went around flaunting his teeth everywhere. And then he said, calls me one day and he says, doctor, can you just close that gap also for me? It will be even better. I said, yes, you have to change the composite. We'll do that. So this is how he is. Within 24 minutes, immediate post-op. And remember, once you do a bleach, okay, a walking bleach or a inside-out technique, you will clean off all the material from the pulp chamber, flush it out, clean it nicely, make sure nothing is stuck behind. Now, as I told you, you cannot do any bonding for the next 3 weeks, correct? So, for the next 3 weeks, I will place calcium hydroxide paste inside the chamber and put a temporary filling. Now, you can place a temporary filling and close it, okay? Call the patient after 3 weeks, flush out the calcium hydroxide paste, and now you're going to place a adhesive restorative. Why am I placing a calcium hydroxide inside? See, now we have placed a gel, hydrogen peroxide inside, and it's cost a lot. It's in an acidic environment, right? So now once you remove it, flush it off, you still have the remnant oxygen. Okay, you have the residual oxygen inside, and that will not allow any composite to bond. So I am trying to move the tooth from an acidic environment to an alkaline environment by placing calcium hydroxide, which has a higher pH value. Right, you place it inside, close it with a temporary filling and send the patient. Call him after 3 weeks, flush out that calcium hydroxide paste, etch the chamber properly, okay, and scrub it with adhesive. Because it's a non-vital tooth, you can etch the dentin, no problem. Scrub it with an adhesive, put a flowable, again cure it, then put a packable, condense it nicely and pack it. Always better to go with a higher value composite, okay, a slightly higher value composite, because in future, even after so many years, if there is a slight change in color, okay, if there is a slight discoloration, that composite actually will add more value to it. Relapse, there is a chance of 30% of relapse. If to avoid that, this is what I am telling you, you have to seal the chamber properly, okay, with a flowable composite, etch it, put a flowable and a composite. If there is a gap, let's say you put a glass ionomer cement and close the entrance filling, GIC will have spaces inside. So there is always a chance of relapse or discoloration after some time. Okay?
Excuse me, doctor.
Yeah.
What about the GIC of the orifice?
You can leave that. The cervical barrier GIC can be there in place. Okay, so that's okay. And now for this condition, for an inside out technique, I don't need to place a cervical barrier. You got that? I don't have to place a cervical barrier for an inside out, because for a walking bleach, I'm closing the chamber. So there's a lot of pressure. The oxygen has no place to move. So it tries to go to the periapical region and it can cause a distress. So that is why I had to place a cervical barrier. But for an inside out technique, I can even skip that step. I don't need a cervical barrier. Directly open the chamber, okay, shear it off below the orifice, place the gel, because it's open and we are immediately doing it within 3 cycles. That's it. You get the result, send the patient. Now the old composites were removed. This guy comes after 3 weeks. After 3 weeks, he wants to change the old composite and close the gap. So what I have done, I have shared. So you can see, if I put a composite on a discolored tooth, it's not going to serve the purpose. So you have a nice bleached tooth now. I remove the old composite. My palatal shelves. It's a pretty bulkier restoration, so I'm just trying to add the same bulk, opaque dentin. Just block it with an opaque dentin. I have my body shade on and my proximal walls are built. I use this proximal anterior strips from Torvium. Okay, so that's one beautiful proximal anterior strip. Use that and build the proximals, and now have a little bit of low trans enamel here, and then just finish, polish, and just after the polishing, this is how it is. So from there we changed it, we brought it to this color. This is how he is now. He's happy with his closed gap, changes smile, and this is how he is. This is a 6 months follow-up. and he's perfect, no change in color. So he's happy with it, and that's it. Now, if I'm going to bleach and bond, as I told you, you have to wait for 3 weeks. This is another case which I had to go with porcelain veneers in this. I changed the old composites. If I'm going for porcelain veneers, again, it's the same thing. I'll remove the old composite completely, okay, do the non-metal bleaching. Then I will wait for 3 weeks and do the restoration, okay. Go with a monoshade composite, just restore it, and then prep it for porcelain veneers. And just 2 porcelain veneers, we bond them. So I can just be minimally invasive, no need crowns. I'm a person who doesn't like crowns for the anteriors. I just go with minimally invasive option. Let it be composite or it's just porcelain, that's it. It serves the purpose. Even for a non-metal tooth, you can lighten the stump shade and just bond with porcelain. Okay, so this is a smile. This is how she is. She was, this is how she is now. Okay, and remember this point, I'm repeating, any resin bonding procedure should be undergone only after 3 weeks. Okay? And minimally invasive dentistry is an art to preserve, respect, and natural underlying healthy tissues. What is dentistry? What is minimally invasive? What is a restoration? Restoration is something where you are restoring the same structure, the lost structure of a tooth, okay, in a very biological manner. You don't want to destruct so much of tooth structure. You don't want to remove the enamel and go for a heavy crown on top of that. That is not restoration. Okay, that's a lot of destruction, I can say. Okay, restoring is just, and this is one I like with what Pascal Magny says. Restoration should aim to create not a strongest material, rather a restoration that is compatible with the mechanical, biological, and optical properties of the underlying tooth. Okay, so this is how we have to think about a restoration. Their crown is not just the solution. Minimally invasive dentistry is what you have to incorporate in your practice, and that's the next generation. That's what I was telling you. We are all moving towards adhesive dentistry. There is a recent study by Marco Gresset where they say if you can do an immediate dentin sealing, okay, even if you have 50% of dentin exposure, if you can do an immediate dentin sealing, you don't need a crown. Just bond a porcelain veneer, and that is it. Okay, it's going to give a durability which is much better than crowns. Okay, so success is no accident. It's hard work, perseverance, learning, studying, sacrifice, and almost love what you're doing. Let it be implants, whether you're doing composites, whether you're doing porcelain veneers, whatever, whitening, whatever, love what you're doing and just do it. Dentistry is actually very interesting, and this is where I upgrade myself. It is from the European Society of Cosmetic Dentistry. This is a conference that happens every year, and I realize, if you travel more, that's where you learn. Someone who even came and asked me, how to do digital dentistry, where is it? There is no particular course for that. You have to travel a lot, learn it from different mentors, different people. So this is how I learned. This is what I can say. And I'm not a very fancy dentist. If you think that I know I'm very, very posh, and I told you I'm from a very small town, this is my clinic. This is where I was. For so many years, in my clinic, just in front of my dental chair, I had 2 softbox. That time, talking about 2008 to 2020, that is the time I had a softbox even then. I don't have a place to keep it, but still I used to document all my work. I believe documentation will improve your skill, improve your, patient conversion rate and many things. So I had this, and whenever a patient walks in also, he'll be like, it's a 200 square feet clinic, you have this. What will you think? Most of them used to ask me, do you do passport size photos and all in your free time? Many of them asked me that. I said, no, I'm doing something called digital smile, and nobody used to believe me because in a small setup, what are you doing it? So it took me so many years to move to a place like this. Okay, so, and again, I have the same softbox there, everything. Because I believe, the patients like fancy stuff. So the acceptance level started getting better. I don't have to tell to Bangalore people. I know all of your clinics are really posh. So I really believe the ambience matters a lot. So it took me so many years to move there. This is my training center. It's called the Melange, and we have 3 days of intensive hands-on programs on porcelain veneers, anterior composites, rubber dam isolation, and all that. If you're interested, you can actually call this number, and we have courses coming up. Our next course is on, it's on July. It's on 17, 18, and 19. If you're interested, you can always call us and come. And this is where I'm pretty active on Instagram. You can message me. I can help you out in your cases. Any cases regarding your whitening or you need a support, I can always help you. You can message me and I'll help you there. And once again, thank you so much. Thank you so much, guys, for this great opportunity. Thank you, Ozzy. Thank you, everyone from 3M and Blancone. Thank you for the opportunity. Any doubts, questions we can take up? Yeah.
We have some hesitance while selecting the case whether it works or not. So can you just share
For bleaching, sir?
for the bleaching especially?
Yeah.
Which case works better or some cases may not work?
In bleaching, usually what I do is, as I showed you, we rearrange the shade tabs, right? We have this shade tabs. And always, when you're doing a case selection, you should always start to see whether it is after the 6th shade. If it is less than the 6th shade, I will not take it for bleaching because that's the patient is not going to appreciate much. So, if it start doing it from the 6th shade, you will definitely get at least a 3 or 4 shade jump. So, a little bit of discoloration should be there. Most patients come having a A1 teeth will want teeth whitening. I'll always tell them, no, it's not going to show a big difference. It's not going to create a big difference. It will look the same. So, case selection like that matters. So, 6th shade is what I keep in my mind. And fluoresces and all, I always tell them beforehand because you have these white spots. After the bleach, it's going to look more exaggerated. So, think about porcelain veneers or some additive treatment like composite veneers or porcelain veneers after the bleaching process. So that I can lighten the stump shade and then go for a material to be bonded on. Okay. See, it's a personal choice. I would say zirconia, I believe it's too opaque rather than Emax or lithium disilicate. I have never found it really so impressive after I take a photograph, Because but if you have tried it with lithium disilicate, if you can really do a proper press and then a layering, the aesthetic sense is much better. Emax is always a better option, I would say. Now still you have ultra trans zirconia and all, but still there is a little bit of opaque which you see. It's not really so natural is what I see, I believe. And porcelain veneer is always the best way to go because you get the shade of the tooth out of that, right? When you bond on a natural tooth, the color takes from the tooth also. So it's more natural compared to a crown which takes the color from its ingot. So aesthetic sense is. Yes, according to European norms, it's about the hydrogen peroxide which should not be above 6%. So, yeah, so 16% of carbamide peroxide, 1/3, it's going to be around 6% of hydrogen peroxide. So, that's the limitation what Europeans have. Pardon? You have to mix it. It's like 2 syringes, right? So, the base and a catalyst when you. You are talking about another brands which come as, The many brands come, when you talk about their hydrogen peroxide, comes in a single syringe itself. But only thing is, going with the 35% hydrogen peroxide is going to cause. Oh, you're saying they have 35%. Yeah, the only thing is that 35% carbamide peroxide needs a long-term application. Correct? So you need to go for a long-term. Whereas with Blancone, you're going to activate it and get that singlet oxygen released very quickly. So that's where this is differing from the other 35% carbamide peroxides. So when you having a normal, you're talking about the normal light cure unit? Yeah, now how will you be on each tooth? You have to just keep applying it on each tooth. Yeah, maybe the time and all that. I've not tried it. Even many of them ask me that why can't you use the Chinese cheaper light unit, because we don't know about that intensity again. So these guys have set it up with a different intensity because each bulb is 50 watts. So their gel is also programmed that way. So the other ones, even Philips Zoom does not have that 50 watts. So you can't even use a Philips Zoom's light. So that's where the company is slightly playing a small role. Laser again, the intensity is different, right? Laser's intensity, the wavelength is all different. So their wavelength is set to 420 to 480 nanometers. Again, their intensity is 600 milliwatt per bulb. So into 10, 6000 milliwatt, I believe. So that much of intensity is what's required, to activate that gel. So even with your light care unit, you will not have 6000 milliwatt, right? So
You said it's 600 milliwatts or 6000?
600, and now you have 10 bulbs. So it's all together is what I'm saying. Each bulb is 600 milliwatt.
Kit is of no use without.
The kit is? Yeah. Without the light, you cannot use it. Maybe you can hire the light from them.
They actually give it.
They give the light to you. Yeah, that's how he tried, no?
That's why I tried the first case.
So your first case, you get the gel. You have a case. Call them. They'll bring the light to you. You can work on it and then give your feedback, and then probably ultimately you have to buy the light. The cost, I think you should talk to them because.
Sometimes I have two questions. One is with vital bleaching. Like
Yeah.
I had a case recently that I very rarely do for the same reasons. They have some people come and bleach because they are almost in that 3-4 shade.
Yeah, very great.
And then even though you bleach, there's hardly much of a difference, and they're like, you can't
Yes.
work in these cases. How do we even manage? Does it really work?
It works with Blancone Ultra then. Blancone's Ultra, there's a study which I can actually forward it. I was surprised to see that. Blancone Ultra's bleach is even better than Philips Zoom and anything else. It's hydrogen peroxide again, it's very intense. You will have post-op sensitivity. So those kind of cases, if you see the discoloration is too much, you will have to go with Blancone Ultra. So according to that recent study which I saw, it's Blancone Ultra works really well. Yeah.
Another question was that there are times when, because all these single tooth discolorations are the history of traumas. So there are times wherein even because of the trauma the canal is broken.
Obliterated, yeah.
In that case, I have tried once to even try an RCP opened to check if maybe there is some patency available, but it's not. So in that case, can we still,
Yeah, still you can.
root canal, can we try this?
Yes, you can, but you'll have to put a gingival barrier because we really don't know whether there is some amount of patency here and there. So just seal it and then go with it. All you want is the bleach to penetrate from the towards the facial surface. Yeah.
We have received one kit, no sir.
Yeah.
With that we can do inside out bleach.
What kit? I am not.
We have received one sample kit.
Oh, they have a kit.
Yeah. So that.
Oh, okay, okay. I'm not sure.
So we can use that one with inside.
Yeah, you are asking with that click.
With that kit,
Ah.
we have received 2 syringes
Ah.
where we have to mix it.
Yeah.
So with that kit we can do inside out bleach. In
No, you can't. You need an ultra for that.
Ultra one.
You need ultra.
Even for the ultra also we need that light.
Yeah, ultra you need light. All their gels work with their light only. So it's like that. And actually, this light is a fancy stuff because mostly whenever we do this normal conventional bleaching, have you noticed patients will not really feel like paying you more because they get the same bleach, they can buy it over the counter and they can apply it. So they don't really find anything great with what you're doing. Okay, this light is actually a real gimmick, I would say. It's a nice investment, Patients like that light that is working. Otherwise, they're like, I can do it myself. I can buy the over-the-counter strips and I can do it. So this light is, I would say it's more like a gimmick. It's needed in your practice. Otherwise, it doesn't look more professional.
A lot of people even ask, do you have Zoom?
You have Zoom, yeah. Patients will come asking, do you have that light? Do you have the Zoom? Then I'll do it. Otherwise, I won't. I've had a lot of patients like that. So only then they find it like a professional approach from your side. You might say, I have this ultra and it doesn't need the light, all that, but for them it's like, why am I paying you so much? I can buy this over the counter $1,500 and I can do it myself. Okay, so I think we have another nice lecture.
Thanks, Dr. Arun. And we'll have a lot of time for questions during the demo. We'll have 2 chairs and there'll be a lot of time post-lunch. Again, another first that I'm experiencing. Dr. Pawan came all the way from Bangalore to Hyderabad for our first program. I have never experienced this in my entire career, that you go from one city to another for the tooth whitening program. So he traveled from Bangalore to Hyderabad for a Hyderabad program in February. He stayed in the hotel as a resident guest there. And amazingly, he was the first to buy the unit in Bangalore. This was in February. He's done about, I think, 12 to 15 cases. He's taken Dr. Arun's help in terms of guidance, in terms of non-vital. So I said he must, come and talk to us and share his experiences, because it's a Bangalore clinic, And believe me, this is my again surprise. I've been a central business district boy all my life. Church Street, Richmond Town. Doc practices in RR Nagar. For me, it was like going to Mysore. I mean, because my school was in this part, So Mithun was taking me there. I said, where are we going, But such an amazing area. And the kind of traction he gets for bleaching in RR Nagar is phenomenal. I mean, he'll share his experiences with you. He did it for the, because you have the Sports Authority of India Sai campus there. So I was present when he did it for the ladies hockey captain, the ladies hockey coach. So, wide perspectives that you can, I mean, it's limitless, the opportunities. Thanks, Doctor, for taking the time and coming here.
Not professionally documented like Dr. Arun's. Please don't mind if there's any issue. Most of my pictures are from my simple mobile. I'm a hardcore practitioner wherein I'm not documented like him. If there's anything, you can talk to me personally. Let me just show you 4 or 5 cases which I could document. I've done close to 10 cases. I think Mr. Ossi was mentioning, and a couple of cases basically without using much of the literature. I've done it with the help of the team, Mr. Ossi and Mithun. I'll just show you 4 or 5 cases. Anything you can ask me, right? Thank you. How do I work? The first case basically, it's a fluorosis case. It's a 37 years old female. I was not aware of the different materials after I traveled from Hyderabad. Only I knew it's a material which doesn't have any sensitivity to the patient. When the Mr. Ossi and team saw the case, they said it's a fluorosis case. I was aware it's a fluorosis case. I didn't know which material to use. I was prepared myself to have use that kit, which I got it with the kit. When I think you can appreciate the first picture, right? I'm very sorry if there's any mistakes in the picture because it's a simple mobile picture. For this case, I've used Ultra, which is a high concentration gel with a gingival barrier for 3 cycles, each cycle around 8 minutes. Can I have the lights off? Second case, a male patient around 32 years of age. Have used Blancone Touch for 8 minutes, 3 cycles. Definitely, I could have good change in shade. This is a Vita 3D Master Shade Guide. It's not a Vita Classic. This is an interesting case. A young lady who walked in. She's for a pre-wedding whitening. She came with the intention for whitening. I had to take her through cleaning, polishing, and then whitening. Can you see the change? This is a different shade guide I have used. It's a bleaching shade guide. Basically, it is, as Dr. Arun was saying, it's arranged in terms of value. I think if I have a picture, I'll show it to you. Basically, what is the difference here is, if I see in my regular shade guide, probably 3 to 5 shades, whereas here, almost 10 shades. So it's easy to convince the patient. We can give the shade guide to the patient. They can, there's a mirror in that shade guide wherein patient herself could see the change, before after change. This is an hockey player. She's not a captain. I'm sorry. I just to correct. She walked into the clinic. A lot of patients come from Sai to RR Nagar, around the RR Nagar. If there are any practitioners, they will know the Sai. Are there any RR Nagar practitioners? Okay. Again, fluorosis case. Have used ultra. 3 cycles, each cycle 8 minutes. Again, a combination case of vital non-vital bleaching. Basically, a patient walked in, with the intention to get a bleaching done for the 2-1. She had undergone a RCT couple of years back due to a trauma. When I saw her, CBCT, there was deficient fillings. We had to get her through re-root canal. Then again, I have used inside-out technique with a Blancone Ultra for 8 minutes. This is the change. And again, no, the surprising thing was after 2 weeks she came to me, to get the other teeth bleached. Thank you. Any questions? Let me see if I have. This is the shade guide. I saw this shade guide in a couple of pictures or a couple of presentations from the Italian guy, Dr. Josephi. This comes with a mirror, in the kit. Yes.
This is shown. Use ultra, Blancone ultra, right?
Not for all the cases. Only for 2 or 3 cases I have used, for the both fluorosis case and one inside out technique I have used ultra. For the non-vital and vital bleach combination, after 2 weeks I have used Blancone touch.
Both have same quantity, ultra and touch.
No, different. Ultra concentration is also different, quantity is also different.
Because you did for non-vital case, and then he came back to you to get the bleaching done for the other teeth.
Yes.
Use ultra.
No, never. Second time no ultra. It was a touch. Ultra was not required.
But fluoride strengths didn't go after the body did. Not much difference after.
Patient was happy with that.
No, that white patches after fluorosis, that's what I was telling. That will always be there with any bleach. That's why you get this uneven shade after bleach. So it's better always to add on with composites or ports. She was happy with that.
Patient was happy with that. I gave her an option for veneer. She was not keen on it.
The incisal shade, that discoloration that is gone, that itself will satisfy the patient. That uneven shade mismatch, maybe that's always going to be there, the white flex.
Frankly, she was very happy. I'll tell you what happened with this case was, in the first session when I. Here actually what happened was, when I used ultra, she had a sensitivity. I had to abort a first session in 4 to 5 minutes. Then later what I did the second and third session, I had to cut down the length of the application. Couple of millimeters from cervical margin I left, and I have used only for both the centrals. She was not keen on the rest of the other teeth.
But you use ultra here.
Yes.
How do you use clip? Sorry, the touch.
Touch and click are the same. They may not give this much result.
In fluorosis case,
No, it's always ultra. I mean, I have used ultra.
because I don't think you mentioned anything specific for the 60.
Ultra has better,
No, that I understood. My question was, if for fluorosis cases, as he said, ultra is better. So that was my doctor. That's what I was. That's what I said.
Also 3 cycles.
That's what I said. So it's not that only ultra will work. Touch is also.
yes, definitely it will work. The intensity of fluoride sense also makes difference.
So when you said she was having sensitivity and you were using ultra in the first.
Yes.
Why not go for touch in the second shot? What time?
Commercially, it's difficult.
I know, commercially
It's difficult because the ultra cost is around 8 or 9,000 rupees. Again, I have to spend touch. Definitely, we could have. Frankly, I have not charged her because she's an athlete, and Mr. Avasi is so kind to give us that kit for free.
But if we want, it's not that
Definitely.
we have to go only like for a fluoride case.
You see, if it was a
with her, right? So like
100%, if it was somebody else or some other patient wherein we charge, definitely I would have used touch or click. Instead of touch, I would prefer click because touch you should have 2 patients in simultaneously. The quantity is almost 3 times the click.
correct. Click is
Yes.
it's just the quantity difference.
Yes. Anything else?
Thanks, Dr. Pawan.
Thank you.
Lunch now, and post lunch we'll be setting up 2 chairs here with 2 suction units and 3-way syringe and everything. So I think one social media personality is coming to get the bleach done, so that we can create more awareness. The second chair, anybody can try. One of you all can be the patient, one of you all can apply it. So it's going to be a lot of fun. You can ask a lot of questions after that. We'll break for lunch now. Thank you so much. From FamDent or somewhere. Yeah. So he'll just tell you all about the lab before we get started on the workshop.
Thank you, sir. So yes, hello everyone. I'm Dr. Vishnu, and before starting, I would like to first tell how pleased we are that dentists they genuinely care about providing results without pain and without sensitivity. And this is a great reminder that modern dentistry is about compassion, about quality, and about innovation. So on behalf of CERX Dental, I would like to say that we are a state-of-the-art digital lab, and we are proud channel partners for 3M and GC across Karnataka. We specialize in zirconia, in PFM and lithium disilicates. We also specialize in implant restorations. And as a token of thanks, and CERX would basically like to thank each and every participant here. And all of you would be getting a Z15 zirconia crown voucher. This is backed by a 15-year warranty. And you can redeem this by giving the voucher along with the work. And along with the lab, we also deal with equipments. We do chairs, CBCTs, OPGs. We take care of intraoral scanners, and our team is always there to take care of the same. Thank you.
So we're going to move on to the most exciting part, which is, how much ever somebody speaks till you see the results. They say seeing is believing. I'd like to first thank Krupa Nebu for coming here and at a short notice. I've just got a profile, so you'll have to forgive me if I'm just trying to read it out here. But she's an accomplished choreographer, fitness trainer, dancer, and film personality as well. So thanks, Krupa, for coming and joining us. She's a social media person, and we will do the blank one magic with her. Yeah, please come. And Doc, all yours. Yeah. So after this, we have ma'am who wants to do her bleach. I mean, just before we broke itself, sir said first volunteer. We have a couple of more other volunteers. The doc is there, which I spoke to her a couple of days back. So let's try to do these. And I would encourage each one of you all to also do it. Dr. Arun will do it with with Kripa. But we have Dr. Pawan also here. But anybody else wants to actually get a hands-on feel, this is the opportunity. Yeah, thank you.
Alright, so let's go back to the, it will be a straight one, yeah, otherwise too much of light that will distract. Always take a straight shot, okay, because he's a professional, so he was too artistic, he's taking from the side. So always when you do a shade match, take a straight shot, hold the shade tab straight parallel to the long axis, okay, the incisal edge to be straight to the shade tab, and this is how you do it. Whenever you take a picture, it should be with the shade tab on it. So first thing what we're going to do is just remove a little bit of the biofilm. I'm going to use a sandblaster. We're going to do a little bit of air abrasion. And she's basically got a very sensitive teeth, that's what she's saying. Even a little bit of, you know, cleaning to everything has caused a lot of sensitivity. So let's see. We're just going to challenge Blancone with this. So first is the cheek retractor. quantity in touch is little more. You can do even 5-6 applications with your touch. With your click, you can maximum do 2.5 applications or 3. Okay, so what we do is, I'm using a click in this case. We will, this is the mixing tip, we'll attach it to one of the base and the catalyst and start mixing them. So I'm going to mix them 50 times. Okay, 50 times at least if you can do it, it's a good mix. Okay, so you will get a uniform color, and I will move all into one of the syringe. Okay, so I take it in this, and you will have a small tip inside. Okay, this is a dispenser tip, so we will lock it to this, and you will break open the seal. Okay, so as I said, no gingival barrier, nothing. We just kept cottons to hold on to the cheek retractor, and I'm just going to apply it. We are not able to put the lip retractor, I'll use a Vaseline to protect the lips. We'll apply a little bit more. One long press, it shows HI, that is high. So we always prefer to go with high intensity, okay, rather than going in low. And again, another time when I press, it shows 8.0. That is, I don't know if you are able to see this. Focus on this. Okay, 8.0. So it's set for 8 minutes. So all I'm going to do is get it close to her. 5 centimeter away. Oops. So usually you have a wheel for that. But, yeah, this doesn't have a wheel. Okay. So this should be slightly more than 5 centimeters, and I'm just going to activate it. Just press start, and you have the light on. Okay. Feeling warm. Down, head down a bit. Yes. Okay. So we'll do 2 applications for her, because I know that the cheek retractor is more of stress. Are you okay with this? Is it too tight? You're all right, right? If you have a suction tip, just cut the tip. If you can, I don't know if you can, shows that it's actually reacting, it's working. It's releasing the hydrogen peroxide. And basically in the Blancone, what they oxygen, which is more potent. Not required. I just slightly activated with the tip itself. That's it. Nothing else. Okay, so we are done with one cycle. Yeah, now we'll use the suction. Yeah, cut it. use a cut tip. Let it be, let it be. Okay. So we'll go for the second application. Another click. I've actually used a little more. So maximum I can do 2 for her. Yeah, touch. Okay. So we are opening another touch so that we can continue it on another patient as well. Yeah, the tip. Yeah, the tip is there, no? Usually once you activate it, within 1 hour you have to finish it. Now what happens is it's starting to release oxygen. So you can't leave it like that. I tried closing it and keeping it, but it will just, the plunger will just shoot out. You'll have that much of pressure. So you have to finish it in 1 hour. Actually, I won't apply this much thick also. In my clinic, I will somehow take it to 2.5 cycles. So this actually I've added more volume. So you can actually control on that amount of gel that you are adding on. Okay, so the wavelength is 420 to 480 nanometers, same like what wavelength that we have in our light cure units. The intensity is high. So let's say 600 milliwatt per bulb, it is into 10. So the intensity is pretty high. You won't get that intensity in a light cure unit where you can show it on all the teeth. So that's the thing. That's where it works basically on this high intensity. Only then that the photosensitizers will start working. It will release, it will break down and it will release the the hydrogen peroxide outside. Okay, so the intensity plays a major role.
The buttons of the machine you explained.
Just one button only all this while. Yeah, it's already set to 8 seconds. 8 minutes. So if I just press start, it will show high or low. No, always on high intensity. Usually you don't need to go with that low intensity. It is actually, when I asked why it is kept for that low intensity, they say it is the European standards, they are supposed to have a low intensity also. Because some patients, if they react with more of hypersensitivity, they have to change it to low intensity. But with high intensity, you won't see any problem. Only thing is probably maybe you can increase the distance. Now for her, I am keeping it little away. Because we couldn't protect her face first. Now we are protecting it. Now we can kind of get it closer. Thickness of the gel, that's what you can say, maybe 1.5 millimeter thickness is enough. I've actually added more. This could be 2 millimeter thicker thickness of the gel. But actually whatever is coming in contact with the tooth is only going to work. All that is excess. I've actually used more. So as I said, her teeth is pretty, she's got a broader smile, we had to use more material, and her teeth are larger in size. So we could go with only 1.5 of click. Right, so usually, actually, according in the manual, click is only for one use. If it's seen, it will be mentioned as only one use, one cycle. And even if you want to go for the second cycle, you have to buy another click. So they use touch for that. So as I was telling you, I use that one click itself for 3 cycles, or at least 2.5 cycles you can take. Get your tongue. You don't have. So is it sensitive? I never had it. Only thing the cost is a disadvantage. If you can think it as an investment and just buy it, otherwise it's not a disadvantage.
To overcome that, did you find anything else?
Nothing. That gingival depigmentation, but that's something which patients don't even bother, and it gets back to normal. Yeah. Other than that, what else? No sensitivity, so that is the biggest plus. So yeah, patients who have already undergone bleaching will really appreciate this because they don't see sensitivity at all. So people come back for this. They come back for this. If you have anything, just raise your hand. No? Yeah.
Is one added advantage?
Which one?
Blank one.
Biggest advantage. How long? It's same like any bleach. Any bleach is the same thing. So when a patient asks you, how long will my bleach last? It depends on your diet, depends on your habits again. A person who's a smoker or a pan chewer, if he is quit pan chewing or smoking and then when they get a bleaching done, definitely it's a long-term result. Dental healthy person, again it's diet, right? So let's say if they can maintain their diet a bit, they are on bland food for a while and then that's good. But that's the problem, challenge with our Indian population. 3 months solid you can. 3 to 6 months you can. See, usually we tell them this. If you do a facial bleaching, how long is it lasting? We know that. You do a face bleach, how long is it lasting? So this is something like that. It's a cosmetic thing. So you cannot expect long term on this. If you want long term, then go for veneers. Go for porcelain veneer. I'll bond it with B1 shade. Don't even think about it. Yeah. Correct. You should say, you can classify it like this. You want a long term permanent solution, this porcelain veneer. Okay. No, but what they claim is being a carbamide peroxide and it doesn't have any much effect on the enamel. You can even use it 6 times a year. So that's what they claim. But if you ask me, I would just be on the safer side. Once in 6 months, safer side. Just we have to be safer because we really don't know this. Yeah, you are the one who's going to face the bill. I did it on my wife. She could maintain the result for a very long time. She liked it. Again, she wanted it within 3 months. Yeah. So the acceptance is very high. Yeah. Now, second time I have applied a lot. See a lot of. See, she's got a very sensitive teeth. For her, it's not even reacting till now. So that's how it is. There is no post-op sensitivity. You don't feel heat? It's a little heat. I'll just move it about. If you have heat, you tell me. She feels a little heat, so I'm just moving it slightly away. What is that? No, it's just a very thick tissue paper kind of thing, yeah. You put your tissue paper, that's what I first, because it was not there, I kept a tissue paper for that. No, that's what, somewhere you protect it, it's fine, yeah. For that one cycle, nothing happens. Second, third and all you have to protect. Yes, you have to mandate. At least, if you can protect it by some way, at least the tissue paper is fine. All that is you don't need a direct impact on the skin. It's not warm, right? Warm on the tooth, on your skin, chin, lips. I'm taking it a little up. Is it okay now? Mostly they'll feel the warmth on the lips or on the skin because that impact is directly there. So, got to keep asking them, move it a little upper, higher or lower. Huh? I've just moved it a little up. Rubber dam is easier actually. But again now upper and lower together, is a challenge. Now, if I put a split dam, I can do only the upper now. I think we'll stop with 2 cycles because her cheek retractor is actually bigger. Yeah, so I think she can wash it. Sensitive? Numb everywhere. Because that's because of the cheek retractor.
I slept off.
Ah, that's a good sign. Yeah, you can see a nice change in color. This is with yellow light.